Stephanie Barry is a busy mother of 4, so when she woke up with a headache and a sore throat, she quickly reached for a rapid test.
So I did it at my nose and it came back negative. So I'm like, okay, no big deal. I went about my day. I got worse as the day progressed.
A search online brought up throat swabbing, a common practice in the UK.
Wipe the soft tip of the swab around the back of the throat.
I did throat, the 4 or 5 times on your tongue and then on your cheeks and then up my nose 5 times. And it came back positive within a minute.
A small preprint study out Wednesday found nasal rapid antigen tests lag when it comes to catching COVID early. Last month, a larger trial out of South Africa called nasal testing suboptimal when it came to the Omicron variant specifically. Epidemiologist Eric Feigl-Ding says this is likely because it replicates much quicker in the upper respiratory tract.
It's a very different virus from Delta. And it seems that you can find it not only more, but also find it about a day earlier if you swab your mouth.
But officials aren't ready to make formal recommendations. The U.S. FDA instead issued a safety warning this week and implored Americans to follow their rapid test kit instructions. Health Canada approves the inserts for at-home rapid tests here. Most advise nasal swabs. And while the Public Health Agency wouldn't say if it would be issuing new guidelines, Toronto ER doctor Kashif Pirzada says the government needs to make adjustments as the virus changes.
It's time to be a bit more proactive. Every house should have a box of these rapid tests. Your throat, I think, should probably be standard now.
He says swabbing your throat and your nose wouldn't invalidate the results. Just make sure you're doing it correctly.
For any mouth sampling, do not drink or eat about 30 minutes before you do the sample.
Barry is relieved she found she was positive before her husband, a firefighter, went to work and her kids went to daycare.
I'm worried for how many people have detected in their nose and then have gone and done whatever thinking they're negative.
The last thing any of us want, to unknowingly risk infecting others. Jamie Mauracher, Global News, Toronto.